Difference between a psychological evaluation and therapy. Hi, I'm Dr. Carolina Jimenez, licensed psychologist specializing in immigration evaluations with a private practice in Texas. I want to talk to you a little bit more about the difference between a psychological evaluation and its purposes and therapy. It's very different. Evaluation is a time-limited process. It's used for diagnostic objectives, and it could be for different things. It could be to assess your mental health and well-being, for a learning disability, for any cognitive or intellectual assessments. For example, if someone has limited abilities or deficiencies in certain areas. It helps guide for people in special education what accommodations they might get. So for example, for people in college, oftentimes they might need longer testing times for certain subjects. Or it might help them when they have a specific learning disability. Could be dyslexia, could be math related. So sometimes they can try to get exemptions for those subjects, or again, like I said, extended testing time, or just accommodations to help them and support them be more successful. There's also evaluations where we test for neuropsychological disorders, Alzheimer's, dementia, and in my case, my private practice focuses only on immigration cases. I work with asylum, hardship waiver, U visa, T visa, domestic violence, and cancellation of removal. So people are referred to me to see the impact that immigration stress has on their health and well-being. And the difference is, again, an evaluation is time limited. An evaluation can be effectively conducted in only one session. As a matter of fact, before I opened my own private practice, I used to be a psychometrician. I used to work for a neuropsychologist, and he used to do a lot of different cases: learning disability, neuropsychology, exceptions for citizenship exam, a lot of different psychological evaluations with different purposes. Now I'm only focusing on the 6. I don't do any intellectual assessments, any learning disabilities, only the 6 immigration cases. And oftentimes one of the things that I hear is, how come only one session? So when I was a psychometrician, we only had one appointment. So we did all the testing, we did the clinical interviews, sometimes it was intellectual assessment, sometimes it was achievement test. It was a long day, but it was only one day. So it's not necessary to come back several days. And this is one of the major misunderstandings of immigration evaluations. People assume that because it's only one visit, it's not as legitimate, it's not as useful, or it's not as valid as going more than once. There are cases where the person might benefit from multiple appointments. For example, severe trauma cases, the person might not be able to share everything at once, and it takes time to build more trust, rapport, to help the person open up. So in those cases, yes, it's clinically necessary to have more than one appointment. But the majority of cases can be effectively conducted in one session. And this is important because oftentimes we see some responses to, oh, this is not acceptable, it's only one session. Attorneys kind of pressuring people to see people in several sessions, when in fact we have to keep in mind, number one, is this the standard for the profession? Which in my case, given my training, education, and experience, yes. Every time I conducted a psychological evaluation, it's only been one session. So I have no reason to break that protocol due to immigration pressures that judges or attorneys might try to impose on me. Number 2, what's best for the client? Oftentimes immigrants have a difficult time attending sessions. For example, it's hard to get time off from work. It could be expensive, time consuming, transportation barriers. So for me to ask that they come back several times simply to try to meet someone else's expectations will be unfair to that client when I'm capable of conducting the evaluation in one session. So the purpose of the psychological evaluation is to see any risk and protective factors that might be coming together and impacting a person's well-being. Based on an evaluation, a clinical interview, and some mental health assessment tests, I'm able to write a report that's often used as immigration evidence for immigration cases. Oftentimes, I only require 1-2 sessions. Therapy would be an ongoing process. It's usually once a week. the goal is to treat symptoms. So the goal of an evaluation is to make an assessment. If there's a diagnosis, provide a diagnosis, give an explanation of the symptoms, but it does not treat the symptoms. An evaluation is not treatment. It's like when you go to any other doctor, before they start treatment, they need to assess what's the medical condition that you have, and that will guide the treatment that you have. Treatment plan, prognosis, medication, everything else. Therapy, on the other hand, is treatment. The goal and the focus is to try to alleviate some of these symptoms, the impact that the symptoms have in a person's lives and functioning, and that could require more time. Usually people can see clients 2 months to 2 years, depending on the severity of the person's presenting concern and the impact in their lives. So again, main difference is objective and timing. The objective of an evaluation is for diagnosis. The objective of therapy is for treatment. An evaluation can be effectively conducted in one session. Treatment will require ongoing sessions. I hope this clarifies some of the confusion. If you are interested in an immigration evaluation, you can call me at 281-709-2933. Thank you, and see you next time.